Dr. Sheila Wiseman from Unilever Research and Development, the Netherlands, explains why Nutrimenthe is studying B vitamin supplementation in young children, the role of B vitamins in brain development, and regulations governing the health claims for supplements.
Why did you choose to study the effect of B vitamins in children aged 4 to 6?
We are interested in nutrients that could potentially optimise mental and brain development in children beyond the age of what you would call infants. I mean, I think there's a lot known and lot studied now in very young children. We're interested to know, if you take the process of brain development a bit further, can nutrients, and I'll go into the B vitamins in a minute, play a role in optimizing, the sort of maturation process that goes on after the sort of the peak of brain development that happens very early on. Now, why B vitamins? It's been established, but I mean, I wouldn't establish is perhaps too strong a word, but there are indications, certainly in older people, that insufficient intakes of B vitamins do have effects on maintaining good cognitive abilities. We also know, I think, just from a biochemical point of view, the role that B vitamins play in certain, as building blocks in certain aspects of neural development, neural building blocks, neurotransmission. So that if you take B vitamins away totally, you see severe consequences in brain tissue. So very little has been done in children in relation to the family of B vitamins, and we thought, well, there's lots being done on other nutrients, very little on B vitamins. Let's have a look and see what we can come up with. I think there's a good hypothesis that says B vitamins could be useful potentially.
Does a high intake of B vitamins promote brain development?
We've performed a large intervention study in a cohort of 250 German preschool children. The intervention phase has finished, so we're currently analysing the data. So I can't say whether we've had a successful result or not. But just to say, they're not high levels of B vitamins, where we only gave levels the same as the recommended daily amount of B vitamins. I mean, I think it's a very moderate intake of B vitamins that we've given that would reflect levels that you could get from optimizing your diet. I mean, we're not advocating vitamin supplementation as such. We're saying, if you optimize your diet, can you have an effect?
We've heard a great deal about diet supplements and vitamins, but not very much about fresh fruit and vegetables. Why do we need diet supplements when there is so much fresh food available?
One aspect of fruit and vegetable consumption is people do not eat the recommended amounts. I mean, I think recommended amounts of fruit and veg range from sort of 400 to 600 grams per day. At least get your 5 a day, and you should get the vitamins and minerals that you need. But people aren't doing that. I think there's a place for either products or certainly awareness, getting people educated about where these vitamins can be found in their food products. But there's also maybe a case in certain situations for maybe fortification of certain foods with extra vitamins and minerals. I think going totally to advocating vitamin and mineral supplementation is going quite a long way. I think via the diet you can do a lot to optimize vitamin and mineral intake to the recommended numbers.
Are companies making misleading claims about their products?
Maybe at the moment. In 2006, a new health claim regulation came in within the European Union to establish a harmonised framework for health claims within the EU to make sure that no company can make misleading claims. It means that the body at the European Union, European Food Safety Agency, EFSA, are currently evaluating more than, I think it's about 40,000 claims that have been proposed by industry and have been in use by industry up till now without much regulation. There has been certain levels of regulation, but they weren't harmonised per EU country, and so every country had its own rules a bit. But now these claims are going through the scientific mill. There are established ways that this EFSA group are looking at health claims, and some are being rejected. So there's a phase now going through that these misleading, if you like, claims will be removed from food and supplement products. So it's an interesting time for the food industry, actually, because the level of evidence required is quite high. They're looking for convincing evidence that a supplement does something good for health, and if you can't establish that, then they will say there's insufficient evidence that you cannot make the claim, because the claim is still being evaluated. The EFSA gives an opinion to the European Commission, who actually puts these things into law. So there's a sort of there's a time frame that's sort of ticking away at the moment. So you'll start to see these things actually having an impact quite soon.